To call the Health, Human, and Social Services Committee to order. And first thing we need to do is approve the minutes of last month's meeting. Motion by Mr. Montesi, seconded by Mr. McDonald. All those in favor? Aye. Opposed? Carried. With that, I'll turn it over to Chris.
Good morning.
Morning.
I have three pretty easy items this morning. The first one is your consideration to add money to the county budget for Trade Act funding for 9 students who are studying at SUNY Adirondack and BOCES.
All right, someone like to make that motion? Supervisor Bramer, second by Supervisor McDonald. Any discussion? Any questions? All those in favor? Aye. Opposed? Carried.
The second one is a resolution request to authorize the chairman to execute a related memorandum of understanding for our cost allocation plan for the coming year. Included in your package is the draft budget for the Workforce Development Board. You see the current year, which is PY17, compared with PY16 and PY15. It says a draft because it's subject to approval by all 3 counties as well as the Workforce Development Board at the June meeting.
All right. We have a motion to approve that resolution. Supervisor McDevitt, second by Supervisor McDonald. Any discussion? Questions? All right. All those in favor? Aye. Opposed? Carried.
I had commented before the meeting started. Usually at this meeting during the year we have our annual allocation, but because Congress hasn't passed the budget yet, we don't know how much money we're going to have. So we'll be doing that next month.
Okay.
And also because the state budget was late, we don't know how much money we'll have for the summer youth program. We know it increased statewide, so we're anticipating we'll have as many slots as we did last year.
All right.
Chris, on your budget, the last item is a one-stop operator. What is that?
It's a long explanation. The new Workforce Innovation and Opportunity Program requires that all of the services be put out to bid and that there be a one-stop operator that oversees basically the memorandum of understanding. And you're required to procure that. So we put a minimal amount of money in there, and we anticipate that we'll use some professional like the State Association, and they just convene meetings of the partners during the course of the year and make sure that we're operating in accordance with the requirements of the not something that's ever been required before. It's one of these kind of good news, bad news. We do have to go out for an RFP for our youth services in the past. We no longer have to do that, but instead we have to go out for procurement for all of the services that the centers provide. So that's what that is. Yeah, it's a good question.
Like an audit?
It's more of a program. Yeah, more of a program audit than a but it's a great question. Yeah.
All right. All right, we'll move on to number 3 then.
And the third one is a request to host meeting of the Workforce Development Board. It's been scheduled for June 7th, and we're planning to host it on the 2nd floor at 333 Glen Street.
All right, motion made by Supervisor McDonald, second by Supervisor Montesi. All those in favor? Aye. Opposed?
You want
Carried.
board members?
I was going to say, I will send you out the agenda, and if you are interested in attending, it's open to the public. I would encourage you to attend. It will be our annual program meeting, so there'll be a lot of discussion about budgets and those kinds of things.
All right, thank you.
I did put on for information. We are partnering with the Lake George Chamber of Commerce to hold a hospitality job fair at the Lake George Forum on May 13th. I thought I was going to have flyers for you this morning. There was a typo in it, so they have to be recreated, but I'll send them out via email. There's a lot of concern about the hospitality industry in particular, finding enough workers for this coming summer season. And we had meetings with a couple of the businesses in Lake George and approached the Chamber of Commerce and with the suggestion that we do a job fair in the village. We have done them in the past, we just haven't done it for about 10 or 15 years. But there is a lot of concern about finding enough labor force this year. So, I mean, we're concerned as well. So we're holding that job fair on a Saturday to see if we can entice college students that might be home for the weekend or out of school for the year, as well as high school students to attend.
Okay, sounds good. Claudia?
Do you know if our congresswoman is making any progress with some sort of exemption for addressing that issue? I thought I heard that she was working on it.
Yeah, I haven't heard anything lately. Yeah, and we're still trying to find out. They did pass a budget, well, there's a proposed budget extension. All those things are under discussion. But clearly part of the issue is the H-1B visas being
Right. Are gonna be-
regulated.
All right. Any other questions for Chris? Not then? Thank you very much.
Yeah, you're welcome.
See you next month. All right, with that, we will move on to the social services part of it.
Next thing.
Yeah.
Julie? You have,
Thank you.
Maureen, you need one for the turn.
Okay.
Sure.
Thank you.
Okay, I'm all set. Good morning.
Good morning. Our first request resolution is the notice to have filled the position of Resource Assistant Number 2. The salary is $44,189, grade 12, step 12. Employee number 11010 due to retirement effective May 31st. This is a supervisory position in the Resource Recovery Unit, and these are the people that help us collect money from liens and other areas, or mostly we do Medicaid, and it's a very important job because we do get money back. Sometimes not what we put out, but at least we get what we can.
Okay, someone like to make that motion? Supervisor McDevitt, second by Supervisor Montesi.
Is this a promotion from within the department?
It may be. It's hard to say how many people are interested, and I didn't really read the specs. If they have to be, some jobs you have to come up from inside, other jobs, anyone that's a Warren County resident can apply.
All right. All those in favor? Aye. Opposed? Carried.
Number 2, we don't have to do because we're doing that outside committee now, and it was just about training. Number 3 is request to renew the contract with the Council for Prevention of Alcohol and Substance Abuse for a youth court program for the period January 1st, 2017 through December 31st, 2017 in the amount of $85,820. And the purpose of the youth court program is to reduce and prevent cases requiring family court and foster care placement.
Would someone like to make a motion? Supervisor McDonald, second by Supervisor Leggett. Any discussion? All right, all those in favor? Aye. Opposed? Carried.
And our last resolution is to request and reappoint various members to the Warren County Youth Board. The Warren County Youth Board membership includes public officials whose responsibilities bear directly on the welfare of the county's youth population, and there's members, we're approving some members that are from the towns have suggested. And the names are in number 3, but we can go over them if you want to. Just
Well, we finally got ours down, Maureen.
Thank you very much.
Took us a while. Someone like to make that...
Waiting from some towns, too.
Yeah, I know. Someone like to make that motion? Supervisor Bramer, second by Supervisor McDonald. All those in favor? Aye. Opposed? Carried.
Okay. We have no pending items. And for discussion, May is Foster Care Month. And then we can turn this over to Edward for Countryside.
All right, thank you. Thank you kindly. Thank you.
Okay, good morning.
Good morning.
Let's see here, we have a number of things on the agenda for Countryside. The first is a request resolution, intent to fill the position of institutional aide number 4, which is a 4-day-a-week position, employee number 12554, base salary $26.58, grade 3, due to a staff resignation. This is a mandated position by the Health Department.
All right, someone like to make that motion to approve that? Supervisor Montesi, second by Supervisor McDevitt. Any discussion? Mr. Leggett.
Thanks. It's checked as other under civil service on the notice intent to fill form. So
It says all right.
This is a tested position.
that would be non-competitive, right?
Right.
Okay.
So what you're saying is they checked the wrong box, Craig, is that what you're looking at?
Yeah, I'm wondering if that's the case. Unless there's some other,
Where it says Civil Service Status and Human Resources Director Approval.
correct.
I'm sorry,
Yeah, it's not a big deal.
Right.
I need to check what?
Yes.
I don't know, but Craig is saying...
They think we're going to
Okay.
And,
Yeah, it's right here, Craig.
okay.
Non-competitive. Okay, sorry about that.
So is it not, Julie, then is it non-competitive?
Non-competitive.
Okay. Other, it says labor class,
Oh,
Labor
okay.
class, thank you.
whatever that...
That's
All right, okay. We'll get to it.
That's a trish.
Thanks.
I just know it's not
Yep.
tested, and I
Good.
guess
All right, I think we need to vote on that, we got sidetracked here. All those in favor?
Aye.
Opposed? Carried.
Thank you. Number 2, a request resolution to fill the position of part-time institutional aide number 4. This will be a 3-day-a-week position. Number 12842, the base salary of $15,494, grade 3, due to a promotion. And again, this is a mandated position.
All right, Ms. Bramer, you want to bring that to the floor?
Sure.
All right, a second to that, Supervisor McDonald, discussion.
Does this go on hourly, or is that, and the total year is $15,494?
Yeah, I believe that's based on the hourly, 8 hours a day, 3 days a week,
Okay.
times the hourly rate.
All right. Let me bring that to the floor, I'm getting confused here. So we're all set? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, thank you.
Mm-hmm.
Okay, the next resolution, from time to time, there are reports that the Health Department requires to be filled out, and we did have an annual report for 2016 that was actually due at the end of January. When I received the email from the Health Department, or the notice from the Health Department, it was dated December. So unfortunately, it was missed, and as a result, the report was submitted, but it was submitted late, and unfortunately, there was a fine that was assessed, a total of $220.
So it's one of those things that happens occasionally. Okay. Ms. Bramer, you want to bring that to the floor? All right, second, Mr. McDonald. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Thank you.
Mm-hmm.
No pending items. For now, we have our laundry proposal to be tabled.
Okay.
Okay, as far as admissions and discharges, we had no admissions for March, and we did have 2 discharges. We did have 1 admission to our daycare program, and that's something that we haven't had a participant in quite a while. So we did get an admission there, and that's some, a little bit of extra revenue coming in. 1 week of that will more than make up for the 220. So currently we have 32 long-term residents, and we have 1 resident in our daycare program. We're currently working on 4 potential long-term residents and 1 potential daycare. So wish us luck when we get those. We'll be going up. Currently we have, again, 32 long-term and 1 daycare.
And I just asked you about the laundry proposal.
Mhm.
Where, did you buy a new washer, or we
Just
still
want to
use?
remind us where we are at this point.
Yes, we've done some research on it, and we've looked at, where in the facility we should put it, where our clean laundry room needs to be, how we're going to staff it. We've taken a look at 3 different proposals, the cost, the function of each machine, and so on and so forth. I did some analysis of it. I think we're budgeted to spend $20,000 for the washer and the dryer. It's going to take us about 3.5 years to break even. And if you look at a 10-year period, the rate of return is like 2.5 to 1. So long term, we would be saving money. If you look at it as an investment, there would be a payback, but you'd have to look at it for at least, as I say, probably about 4 years to break even, and about 10 years before we start getting a good return on investment. So right now, because of the water issue with the main, that the project is supposed to be starting in the summer, we kind of are holding off on it. I think,
We're still using a vendor in Morrisburg?
yes, we are, yes. And they have...
At a new price?
Yes, a very much higher price. So yeah, that's the case where we are right now. I think if we, in my own opinion, and again, I'm not trying to tell anybody what to do or anything, but my own opinion is that right now, if we invest any money, I would like to see probably some money going into our marketing efforts to get our census up, because that's going to pay us an immediate return. There's no real big outlay other than what Maureen said about maybe hiring a part-time case management person, maybe for 20 hours a week, which would free up my time to do more of the marketing, to get more people in there, because we do have a lot of irons in the fire regarding the marketing, and the more people we get in, obviously, the better for us.
So basically, I mean, even though it's a higher price, the service is okay with the laundry that we're using?
Well, I would say, yeah, it's okay. I'll give them maybe a B. We have had some instances where the laundry comes back and, there's stains on it, there's bleach stains on it. So I'm in the process of right now, I've got to approach them to see if we can get reimbursement, because, the residents, they don't have a lot of clothes, and, sometimes they come back and they are kind of damaged, so I need to kind of seek remuneration or reimbursement for that, which I'm in the process of doing. Once in a while I've heard, not lately, but in the past I've heard sometimes clothes are missing, resident clothes are missing. So it's a situation, where we're paying more, but we're not really getting more because we do have some of these issues.
So you'll be working on that then?
Yes, we'll be following up on that. All right, good. Yep.
And you're good on the staffing now, Edward, now that you have these 2 positions? Are you okay then?
Yeah, it's been extremely challenging over the winter. We did have one 11 to 7 institutional aide who did resign for a better paying position, or that's what she said. We had another 11 to 7 aide who injured her patella, and as you probably know, it's very difficult to fill that shift. We had another housekeeper, a cleaner, who broke her toe, and last word is she might need an operation on her foot. We've had people calling in left and right sick, which is one of the reasons why overtime is through the roof. So we've worked, frantically to fill all the slots that we've had to fill, and we were successful in doing that, but at a cost of much higher overtime. I must say that everyone, the majority of the people there, 90% of them have been very good in adjusting their schedules, adjusting their home life to be able to fill all the slots that needed to be filled. So we were always able to have at least 2 aides on every shift. I have to really, my hat's off to the staff. They've pulled together as a team during a very difficult time, and we've got a lot of support from a lot of people, and we were able to, keep going and do what we needed to do. So that's been a challenge, but now that we have the approvals to hire people, we do have a couple that we interviewed. One of them is very good. She's young. She's willing to work 11 to 7. She lives locally. She would be a great addition to our staff. I hope she's still available. I think she is. I'll contact her later today, and we'll try to, get her in there as soon as possible, because she would be a really great asset for us.
Okay, well, that's encouraging. Ron?
Not to belabor it, but that, your comments about hiring folks, if we would go to a washer and a dryer, that means another person that you're going to have to hire and worry about, and I figure that in when you're figuring the cost
Right.
of it, because
True.
that could be a real,
Right.
if you have a vendor that you're working with that needs a little boost, let's do it, but
Right.
I think that would only add to your concerns.
Right. That's a very good point, and I believe we did take that into account when we did our expense analysis, a part-time laundry person, and that figure, that expense, I believe, was included on that rate of return that I projected. The only question, I think, as far as our expenses with an in-house laundry would be the water. I don't think we have a final figure on actually what that water's going to be.
You got our administrator working on that.
Right, okay.
All right. Edward, you have something, the overtime.
Right. Okay, and then, the last item is the overtime. You can see, it just was through the roof in March. Hopefully, now with the better weather and the new people coming on board, we'll be able to get that back down. But it was pretty high.
Okay, thank you.
Welcome.
Now, I guess it's Julie now?
Julie now.
I had one question. Maureen,
Yes,
because some of these positions are mandated,
right.
do we need to reconvene sooner to allow him to try to fill some of these, to avoid some of this overtime? I see most of it's in March, and we're May now.
Right.
Could we have convened a meeting sooner to try to get some of this help, or would it make sense?
I think occasionally it would. By the time we got all this together, we were a week away from coming here.
Okay.
So we settled with that since they were doing well, but there may be some time in the future. Jobs like this have big turnover. Although I have to say, for Countryside, we have a lot of people that have been there for quite a few years. But that also means people are probably more vulnerable as you get older to, when you're helping people, assisting people, you can get hurt easier than if you're young and whatever, speaking for myself.
Yeah, but I'm just saying, if we needed to get together sooner,
Right.
don't be afraid to bring that through so we can
Thank
look
you
at
very
it and
much.
see if we can't fill those positions. I mean, you look at your overtime versus filling the position a little bit sooner. Plus, the fact is, these are mandated. It's not like you could not fill the positions. Okay.
Well, thank you very much.
Yeah, that would be great. Thanks. Yeah.
For social services overtime, are holding steady, and a lot of our caseworkers were starting to see that downside of their training. So hopefully it'll keep us at a steady rate for overtime. And for our budget revenue, I did run just the top sheet for the 2016, just so you could see where we came in at for our totals for 2016. cut it pretty close on our expenses, but we did come in a little under budget there, and we're a little under budget in revenue as well. But all in all, it really looks quite well for 2016.
Good, looks good. Any committee members have a question on the budget or expenses, revenues? Good. Anything else, Maureen?
No, there's nothing else this morning, thank you.
All right, thank you.
Excuse me, Mr. Chairman.
Yes.
Maureen, I just wanted to say thanks again. Back, maybe a year ago now, yourself, a number of people from your department, representatives from Glens Falls, we all sat down at the table here about the issue of DSS liens on some houses in Glens Falls. And since then, I believe we've been able to put 3 of those properties back on the tax rolls for the city. And City Councilman wanted to relay a thank you to you guys for cooperating and following through on everything that you said you would do in that meeting. And I think on behalf of this president here too, thank you as well.
You're welcome, thank you.
Thank you for sharing that with us. Appreciate that. All righty, thank you. Have a good day now. This is here. You can leave it.
I'm here all day.
No justice.
Did they say they were going to keep coming in? Anybody for yeah.
Forms, actually, when it comes to the agenda, you can see there's a spot. I'm not sure why he brought them back, because these were, oh, yes, you did. I'm not sure why, so I had the other, I just wrote one up
Yeah, did the video.
I saw it after you and I.
I don't notice it, I just...
I'm open speaker. It was just, because I went down to Kevin the other day.
This you're filling.
Right on the corner.
Mine are.
He offered it.
Otherwise,
Mine are, and I'm
Right
sure
away.
we have the old, those short ones.
Basically, where they are, and then we're going to talk about it on Monday. So I think
She doesn't dare try to move out of the chair. She never knows what's going to happen. All right, I think we're all set to move on to the next part of our meeting. Are we all set?
Kevin did.
Okay, we'll wait for you.
Right there, we'll Patty.
Okay, Pat, it's all yours.
Okay, thank you. Good morning, everybody. First thing on our agenda this morning would be to just bring everybody up to date, at least this is what I think I'm supposed to do, with the new committee approval to attend conferences. If something happens during the month, we're just supposed to include it on our agenda, so we did have 2 things for the WIC employees to go to the New York State Annual WIC Conference in Rochester, which is coming up, and 1 for a nurse to attend the Oasis Accuracy, and I did transmit the information, but I didn't include it in your packet today. So there were funds to cover those initiatives.
Okay, good.
Okay, moving on, we'd like to request a resolution to renew our contract with New York State Department of Health Research Institute to allow for continued funding for the Emergency Preparedness Program for the coming year, July 1st through June 30th, in the amount of $52,096. This grant, for whatever reason, has been changed back from a multi-year to a 1-year. The grant funds are used to meet the deliverables, pay for staff to meet the deliverables for the program.
I'll move that.
All right, second to that. Mr. McDonald, any discussion? All those in favor? Aye. Opposed? Carried.
We would also like to request a resolution for a budget amendment to the 2017 budget to accept funding in the amount of $18,020 to adjust the Health Services Home Care Division budget to reflect funds that we received from Adirondack Health Institute to support the DISRIP initiative.
Someone like to make that motion? Supervisor Bramer, second. Supervisor McDevitt. Any discussion? All those in favor? Aye. Opposed? Carried.
We would also like to request a budget transfer, attachment number 7. Ton, do you want to comment on that?
It's just for $37. Basically, we had an employee that left WIC and had some comp time accrued, and therefore when they leave, we have to pay an overtime. So it was $37, and we don't have any overtime budgeted for the WIC program, so I had to move that money to cover that.
All right, would someone like to make that motion for the transfer? Supervisor McDonald, second by Supervisor Bramer. All those in favor?
Aye.
Opposed? Carried.
Okay, we'd also like to request a resolution to authorize the sepsis screening tool license agreement with Home Care Association of New York State at no cost to Warren County. Tammy, if you want to talk about that.
Sure. Home Care Association, which we're an active member of, worked with a lot of other stakeholders in the home care industry. One of the biggest reasons for rehospitalizations and is sepsis once a patient leaves the hospital. So they came up with a screening tool for early identification and education for our patients. We're going to be able to update our software at no cost to include the sepsis screening tool in the software so that it won't be a separate piece of paper the nurses will have to use. So there's no cost to us. It's simply something that's being provided to Home Care Association members, and in an effort to decrease the prevalence of sepsis.
Okay. All right, someone like to make that motion? Supervisor Montesi, second by Supervisor McDonald. Any questions? I think Craig? We'll let Pat explain it. What is sepsis?
What is this infection process? You don't want to get it.
But does it quite often occur after you've been to the hospital?
It's really in the community, but there are also instances in the hospital, so it's a way of tracking and getting better data. So,
Okay. Okay. Is that the one, though, where you go into the hospital and you have to put on the yellow gown and the gloves and all that kind of stuff? No? That's not the...
Not necessarily.
It's actually an infection in the blood. You can get like septic shock, and it can actually be deadly, or you can lose limbs from that.
Oh, wow.
It's basically an infection that you get when you leave. hospital.
Staff inspection.
So I think because a lot of times what we do is, do wound care after, incision care after somebody's had surgery. It's just being able to monitor for those symptoms so you can quickly catch it, get them back in the hospital, get them treated so that they don't get sepsis. So
Okay.
that's the reason for the screening.
All right. We have a motion and a second. All those in favor? Aye. Opposed? Carried. All right.
And regarding the pending items, this is just a little update on the Tobacco 21 initiative. You're all going to be getting a survey that's going to be sent out by Adirondack Health Institute, which are the lead agency to solicit opinions from various county legislators and agencies, and they want to find out what the feeling is from as far as legislators and people that are in the know. So if you'd like to fill that out, I will be getting copies of the results, and we'll keep you updated on that.
All right, good.
Okay, Ton, report of expenditures and revenues.
Attachment 2 are financials currently. I ran these, I believe it was last Wednesday, to get these out, and just to also announce we closed March the next day, and on top of this we will be adding another $281,423 for revenues for our MCH and CHOP programs. Again, we're looking at the salaries year-to-date compared to last year on the bottom of the page, and you'll see that right now we are 25.31% of our salary budget, where last year at this time we were at 30.84%. We're down in our regular salaries, and again, a lot of that has to do with our nursing positions. We have new nurses that have started, so we have filled those. And our overtime salaries are down a little bit, and that's, again, we have a lot of per diem nurses that we're utilizing, which has helped out a lot. Another thing to bring up is that we do utilize comp time with some of the nurses, so that does help with keeping those salaries down too. On attachment number 3, this is our comparison of this year to last year at this time, and you can see again where we're down overall in salaries about $101,000, and our contractual or all our expenses are down, and that is primarily to do some research. Our preschool program, which does add up the month of March, we are in the process of getting those invoices in. Actually, they're turned in today, so that kind of just due to timing. Actually, in that case, we're a little bit above in revenues overall, and right now in the month of March that we just closed was our highest revenue so far this month for the CHA, so we're looking good, we're on track.
Okay, very good.
Okay, thanks. Moving on, you'll see attachment number 1, the emergency response and preparedness for monthly report. If you have any questions, I guess we can move on to status of referrals. And Val and Tammy, we've had a busy month. Val, do you have any comments?
Our status of referrals was 19% up from last month, which was a plus, and nurses have certainly been busy enough to reflect that.
What do you think's causing that?
I've been told, not official, but one of the other home care agencies are down in nursing. So when they can't take the referrals, then they come back down.
So our competition's having a hard time.
Off the record.
But now on the record. Got that camera on.
Very hard to know how to explain things. Okay, Tim, you want to talk a little bit about the homework assignment?
On the what?
The homework assignment?
Oh, yeah, you all have a homework assignment. I don't remember ever in 20 years giving you a homework assignment, so now, here's your homework assignment. We are, one of the things that we talked about earlier in this meeting was the fact that we were changing our budget to accept more funding from the district project. So we're up, the home care division is up to about $45,000 that we've accepted this year. We'll continue to get funding through that. And basically what it is they're revamping the Medicaid system of payment. And so last year we became a member of a performing provider system. We became a member of its Adirondack Health Institute, and we're members, Glens Falls Hospital members, Hudson Headwaters Network, our other primary care physician groups, Iron Gate. And basically what we're looking to do is improve delivery of home, it could be any type of care to a patient, so that we are very active in collaborations with Glens Falls Hospital and Hudson Headwaters, talking about rehospitalization rates. And yeah, you could say that the Glens Falls Hospital stands to gain the most, because if the rehospitalization rate goes down, they get more funding. But really, it's better for all the patients. Patients don't want to go back in the hospital. So does it mean keeping them an extra day in the hospital till they're a little more stable before they go to home care? Or maybe going from the hospital to a skilled nursing facility before they go to home care? And working with the physician's offices, when our nurses are out in the field and they recognize maybe a patient's weight is up due to congestive heart failure, perhaps that's when you want to give them Lasix immediately, get a script for Lasix so that we can get that down without that patient going to the hospital. So it's those types of things that we're involved in. We're involved in a palliative care program, which is kind of end of life planning per se, and what's the best for patients to try to keep them in their homes as long as they can possibly be in their homes. So anyway, that's kind of what DSRIP is. That's our involvement. We are a partner in that. And as a partner, that $45,000 didn't come out of the trees, though that would be kind of nice. It actually came from Medicaid. So because it came from Medicaid, there's a lot of corporate compliance that's involved with the Medicaid program. Medicaid program, because there's corporate compliance and you all are the end decision makers for the Health Services Committee, I spoke with the corporate compliance contact at Adirondack Health Institute,
And what she would recommend is that our Health Services Committee it's an online, about 30-minute training, and there is a link to that training in attachment 5 in your handouts. We have until the end of this month to comply with this, and then I'm going to send in a letter attesting to the fact as a compliance officer that we all did comply, so it'd be awesome if you all would, because my name is going to go on this letter. That's going to go back to Adirondack Health Institute. And like I said, it's a 30-minute, and it talks about Medicaid funding, it talks about whistleblowers. If you think that something's going on that shouldn't be going on, there's hold harmless, you just let them know. And like I said, the link, it's kind of on attachment 6, it's kind of towards the bottom of the page.
I'm going to suggest that you email that out.
I can.
Just actually click on the link.
You've got it. Absolutely.
Yeah, that would be good.
And then there's a little, once you get there, once you click on the link, it does say, I'll let you know. You just scroll down a little bit and you'll see the video with a play button. And it'll automatically play. Again, it's about 30 minutes long. And the other suggestion it was Alicia Sirk from Adirondack Health Institute, is even though we're asking that you do that because I'm going to attest to the fact that you did, certainly we want to make it available to anyone on the board that's interested in taking the training, not just the committee. So we'll let that go forward to the full board, but then we could get that email so that we can send that out so others can do that as well.
Thank you. Yes, I'm sorry.
What would a typical question be like
What a typical question?
on this question?
Oh, there won't be, it's a video, it's just a little webinar. It's a PowerPoint, and actually, the way they did it was kind of nice, that when I talked to Alicia, she said, then they could watch it at home in the comfort of their couch. It's kind of like how I developed the PowerPoint, so really, it's a PowerPoint presentation that she's made into a video so that you really can watch it at your leisure. So there's no test. So you do not run the risk of failing an exam that we're going to have on record.
How do we get the credit?
How do you get the credit? Well, I don't know. You'll have to ask your chairman of your board. No, I am going to actually, I don't know that you've taken it. I am going to trust that you're going to take it and finish it by May 31st. I will send that letter in, and I'll just let them know. They're aware of the way that we're going to do this, and I will let Adirondack Health Institute know that.
Well, our county administrator has a suggestion, or whoever, that how about if we watch it after our May board meeting? That way, everybody's on board, everybody will see it. If the committee doesn't have an objection to that, let's...
That works for me.
So,
I'll be
As
there.
long as there's popcorn.
oh,
You bring
we
popcorn?
don't need a
I'll bring
motion or
popcorn.
anything for that, do we? No. All right, then we'll plan on that. We'll do it after the May board meeting, and that way we'll have everybody on board. No excuses for not doing it.
Thank you very much.
Thank you.
Keep the meeting short because it's 30 minutes.
We'll be the Banner County for sure.
Right.
We do that. Okay.
Good, Kevin.
Moving on to, thanks, Tammy. Moving on to staffing update, we still have several open nursing positions, and we continue our recruitment efforts. However, on a positive note, since last month, we've had no resignations, no retirements, and we're
First month.
That's good.
buzzing along for
Good.
cautious optimism. With regard to the rabies situation, we're feeling this month pretty good as far as we think we have a plan for having our situation solved. We did have a meeting at the request of Sheriff York after the Criminal Justice Committee last week. We did meet with the SPCA. Jim and Darlene were there, and their attorney, and then there were Mr. Conover, Mr. Garrity, Under Sheriff, the Assistant County Attorney was there. Our assistant person, Matt McDonald, was there because Mrs. was not able to make it. Also, Supervisor Schieber was there, and Supervisor Montesi, because she is the chair of the Criminal Justice Committee, and Janelle Pep-Eldon, who is our communicable disease nurse, and myself were there. And we discussed our various issues regarding our concerns, their concerns. The SPCA presented a plan and their costs for 3 options regarding doing bites. And after that meeting, we went back and analyzed what we thought needed to happen, and we've come up with a plan that we met with Mr. Garrity and Mr. Conover afterwards to review our plan, and they were in support of it. So we will be looking to have a referral to the Personnel and Higher Education Committee. Basically what we did is Janelle and Pat specifically worked hard on it. They went through all of the bites that we had last year and decided that we would be able to only need follow-up on about 100 bites. So that was really, we didn't need to do, and we internally would handle the other 150. So what we would be doing is handling the ones that are like owner and victim. Like if your dog bites you, we would be doing all the follow-up within the health services personnel to do that. So we wouldn't, and that's allowable with the state. The thing that we would be looking to do is handle have a hire animal control officers to just do the bites that would be not an owner victim, like if it's somebody else. And we would be doing the ones like if it's a vacationer, we'll do all of that follow-up. So in order to do that, our plan is we would obviously have to, we would pay per bite incident, and we'd like to hire animal control officers that would work specifically in our department. We would tell them when we have a bite, they would go out and check it, we would pay them per bite. And how we plan to, because I know there's been concerns about having people go out that don't know anything about animal control, and it could be dangerous. What we would be looking to do is hire animal control officers that are no longer working with the SPCA and pay them. So it would be a way that we'd be able to have people that are kind of in the know to do it, and also give those folks a little bit of extra money that they don't currently have. What they would do is, like if they were willing to do it, and we have not reached out to anybody because we had to have this meeting with the committee. Like if we were to use the animal control person that works in Chestertown and she wanted to go, say, to Warrensburg and do a bite, then she would be paid by us. The other thing we would do in order to keep things fair, and we did come up with, the amount of money and which we will be able to fund within our department so we're not asking for 1 penny extra. We would, like I said, we'd have to hire several of them, so that would need to go to personnel.
Right.
But I think it could be a really pretty good system, and it would free up the SPCA to continue with what their mission is and not have to be, and we would continue with our mission, which is to follow up and make sure that the bites are followed up on and documented. So in order to have that happen, we would need to hire somebody. I did talk to Trish Nenninger about the civil service implications, and she seems to feel that we would hire whatever we wanted to do provisionally would not be a problem, and she feels it can be classified as non-competitive, which is a good thing, but the way the state works, it's got to go through that process. Meanwhile, we could still do what we need to do until that happens. So, like I said, the next step would be the Higher Education Committee meeting and we at that point, and I didn't really lay everything out exactly because I didn't know, number one, what the feelings were going to be from this committee, but I think it's good. Actually, one of the things that kind of struck me, that how you get used to dealing with the same way all the time, not always a good thing. And Mr. Conover, I really do have to give you credit for saying sometimes the paradigm changes and you need to adjust your own way of thinking. And so I think because we'd always done it one way, and now we need to do it another way for both agencies. And again, we certainly would be working with SPCA. It would just be, we'd be doing some things differently, and he'd be relieved of doing some things that have obviously caused an issue with his agency. In the event that all happens, we would need to obviously request, and I don't know whether we would do it on an out-of-committee resolution or do it at the next meeting, but we would have to do a resolution to amend our rabies plan that would reflect the new changes that we would have. So again, I guess we can work that out later on in the month. The other thing that's a problem is while we're going through all of this in the next month, if you feel that's the way you want to go, we do need to kind of hire somebody kind of on an emergency basis to make sure, like we have somebody, there's one in Lake Luzerne right now, that it's not an owner victim, it's some other people, so we would need to have somebody to go and check that out. We've been very, knock wood, lucky that in the last month or so, the ones we've had have been owner victim, and actually we've had a little trial run, we've been able to take care of them quite nicely in our department. So we figure probably if you take 100 bites, maybe cost about $4,000 a year, which is really pretty okay. I don't know, Kevin, if you have anything.
Well, I guess what is she looking for from us as a committee? We have to, like,
Well, you have to
approve of the...
approve a modification to the rabies plan, so, and then allow them to hire temporary help,
And we have to go to personnel to get that.
which is what, Thursday?
Right.
Thursday, finance
I
person?
think it's Thursday.
Yes, Thursday.
Yeah. Would you like to make that motion, Matt? All right, Matt will make that motion.
I'll second it.
You'll second, and you had a question, I think,
Yes,
Ron.
thank you, Mrs. Auer, for handling this
Yes.
situation. You know,
Like I said, it was interesting that, you know, when life, you think hands you lemons, sometimes we might get a situation that we're going to be able to be okay with. And hopefully, like I said, I'm kind of excited about the fact that the people that have not historically gotten paid a little bit, we might be able to offer them the option. And again, we would do it across the whole county. And we have heard some scuttlebutt in the past that there are people that really would rather not have given up what they were going to do, so.
All right, any more discussion on this from the committee? Yeah, just a minute. No one from the committee? All right, Ron?
Madam Chairwoman, just, Pat, congratulations to you and your team. You continue to amaze. Very professional, responsive, very little cost to the program, and it's interesting because then I look at, it'll come up later in the meeting, attachment 3, and to see how you've been responding to the lack of nursing staff. I assume these numbers reflect that in part, and and it doesn't look to me like you're spending the same amount in per diem. It looks to me like you're managing, well, if you look at these numbers, slightly over $100,000 less in personnel costs year over year, which is, you know, that's year to date, which is, I think, remarkable given the kind of numbers that are total. So, again, kudos to you, your whole team, once again, just amazing.
Oh, I'm sorry, yes, Jean.
You mentioned Lake Luzerne. We had that dog bite there for everything.
It was last week, like Friday.
That's right. I didn't find out until Sunday night, last night. The family was really upset because I got a call. I hadn't returned it because I guess it was early in the afternoon, and I didn't have my cell with me, but I returned it at night. And I don't know all this new changes. It sounds good, but the problem I have now, I called Fitzgerald this morning, not knowing what went on here. He didn't know anything about the bite.
He's not doing bites right now.
Right, well, that's, I didn't know that, and I hired my dog person in the town, we're paying him. So I assumed, but the people wanted an answer now. I'm gonna tell you what happened, and please, I'm not trying to get anybody hollered at or screamed at, but according to the family, especially the husband, he was on me now and screaming. He said that his wife got bit walking along the sidewalk in Lake Luzerne, and she's a nurse at Saratoga Hospital. I assumed from us here, so that's what happened. But somebody, I guess whoever talked to him, said that they had to go back to the house to get more information on the owner and the dog. That, the person that got, the husband said to me, it was kind of right. He said, it sounds like a rape victim, police telling her to go back to the house where she got raped and talk to the guy that raped her. So that, he was upset.
What I found out on Friday, and we did get more information this morning, is that the person who got bit was watching the dog for somebody else. And so our communicable...
She said it was his wife walking down the sidewalk. And the lady that also was, of the dog was watching the dog.
Okay.
Not with somebody else.
There's two different families.
Right, yeah.
Actually,
so-
three different
Yeah,
families.
the lady that got bit. The person that had the dog in there.
All right, Jean, do you, this is,
Watching it or something.
could we maybe take care of this between the two of you afterward,
Yeah,
rather than not in
I'll-
committee? I just think it's better at this point. All right, let's go back to the motion that was made, the second. If there's no more discussion, let's vote on that. Everyone in favor?
And this is for revising
The rabies?
document.
And giving
Uh,
Pat permission to, you have to, you're looking for people to,
Yeah.
that she's,
Fill in on for...
Right,
for
to
events.
temporarily, and then go through the
Okay.
process as far as going to personnel.
and then it has to go on to personnel, right?
Okay,
All right,
thank you.
all right, all those in favor?
Aye.
Aye. Opposed? Carried. And yes, Pat, we're very pleased with the job that you and the two ladies in
Everything
your
new
department.
always gives you a little bit of trepidation.
Well, that's fine, you did a
We're
good
thinking
job
it's
with
gonna
it, so.
be- Oh, I didn't do anything, I'm the staff did.
I know, that's what you said, the girls, the ladies worked very hard at
They
that.
worked very hard.
All right,
That's all we have for you.
anything else? All right, thank you very much. We appreciate the good job in your department, you know that.
No,
Yeah, we-
no,
No,
I have
we-
nothing. Wait.
My committee, we're still here, don't leave, because we have to hear from Mary. This committee, right?
Yes.
Okay, so if you're on the committee, sit back down.
Not you.
Bad.
We have to do an executive session to discuss financials in particular.
Okay, so I'm going to need a motion to go into executive session
What's it regarding?
to discuss the financial,
To discuss finances of a particular person.
discuss the financial situation of a particular person.
Yeah, I'm not, it's okay. I understand where we're going, I guess.
Okay, so Mr. Leggett made the motion, a second by Mr. McDonald. All those in favor? Aye. We're in
John?
executive session. Taken in an executive session, but at this point, Mr. Montesi, you would like to make a motion?
Make a motion, Mary, did we-
To accept the settlement to,
With an account at Westmount.
oh yeah, with an account at Westmount, thank you.
All right, a second to that motion? Supervisor McDonald, any discussion? All those in favor?
Aye.
Opposed? Carried.
Now you need to adjourn this.
But I need to, we don't have any more in mind, we have to entertain a motion to adjourn. Mr. McDonald, Vice President, all those in favor?
Aye.
Okay. Do I have any more to sign or whatever?
No, we got it.